Hello, it's Dr. McCaffrey here. What I wanted to talk to you about in a quick short video is the age at which a child should first be seen for orthodontic consultation or a screening appointment. Many of the adults that come into our practice mention that when they were children, no one got braces or orthodontic treatment until they were 12, 13, 14 years old, and they had all their adult teeth in. And that was primarily the case back in maybe the 70s and the 80s. However, we've learned a lot since then. One of the things that often happened in the 70s and 80s is patients would have 4 premolars taken out, 4 permanent adult teeth taken out of their mouth in order to make room for all the crowding that was occurring in their mouth. And what we've seen is that by taking out 4 teeth, the front teeth actually came back and the crowding was resolved. But it made it so that the upper and lower lip were a little bit flattened, making the nose and chin look bigger. So whenever possible, we avoid or attempt to avoid taking out permanent teeth. And what we've realized over years and years of research in the orthodontic community is that by treating children when they're 7, 8, 9 years of age, they're still growing, and the forces that we put on their teeth are able to actually expand their jaws as they're growing to make room for those incoming adult teeth before they become severely crowded. So that's one reason we like to sometimes treat children at a younger age before all their adult teeth are in. Another reason we might want to treat children at a young age is to address a crossbite, whether it be in the front or in the back. Now, a crossbite could potentially cause a shift to the lower jaw. Because what happens is the upper arch constricts, the jaw is going to shift one way or the other. Now, as the jaw shifts and the child grows, if they continually bite in a shifted position, they can actually grow asymmetrically to the point where by the time they're 12, 13, 14 years of age, their lower jaw is actually permanently shifted to one side or the other, simply due to the way that they've been biting for so long. So whenever we see a crossbite, we want to address that usually immediately to get the patient out of crossbite so that they can bite down without shifting, and they'll have symmetric forces on their jaw joints and their musculature and resolve that crossbite so that they do not grow asymmetrically, which could become a problem later on to treat. A third reason, when you go to the dentist, the pediatric dentist, the dentist may be taking x-rays of each individual tooth, which is great, but at the orthodontist, what we will do is we'll take a panoramic x-ray that will show an image of all the baby teeth and the developing adult teeth at once. And through that image, we might determine that an adult tooth is coming in the wrong direction. Well, if that isn't seen at the age of 7, 8, 9, 10, whenever we see the patient, there's a potential that that tooth might get stuck up in the bone or kind of make a wrong turn and head toward the wrong direction. However, if we see that at the right time, sometimes we can simply remove a baby tooth a little bit early and make room for that adult tooth to redirect into the right position. So those are just 3 reasons why the American Association of Orthodontists recommends that all children are seen by or before the age of 7 for an initial orthodontic screening. A lot of children, many children don't need any treatment until they're 12, 13, 14, and many children don't need treatment whatsoever. However, for some of these more involved treatments, there are certain things we can really catch early that will make a world of difference in the final outcome and the total length of time that the child will need treatment. So therefore, at Lunch for McCaffrey Orthodontics, we do recommend seeing all patients, their siblings, and kids before the age of 7. Thank you.